Hello, my name is Teresa McLaurin, and today I would like to discuss how to use an Epipen. How many people have allergies? Well, according to the CDC, there are 15 million people today who suffer from some form of food allergies. And the 8 most common food allergy are milk, eggs, peanuts, tree nuts, wheat, soy, fish, and shellfish. Shellfish could be anything from shrimps, crabs, lobsters. And also, according to the CDC in 2012, there are over 17 million adults and over 6 million children who have been diagnosed with hay fever. That is a lot of people diagnosed with some form of allergies. Well, today I would like to discuss the importance of using an EpiPen. And the 3 most important factors when it comes down to using an EpiPen are: why are you using it, when to use it, and how to use it. And how to use it is the most important of them all. First thing I would like to discuss is, what is an allergy? An allergy is an abnormal response of the immune system to certain substances in our environment called allergens. And those allergens can be anything from pollen, mold, pet dander, and even down to just basic food. Once our bodies are exposed to those allergens, our body then begins to have an allergic reaction. And those allergic reactions can be anything from mild to severe. And mild could be as simple as watery eyes, runny nose, scratchy throat, to severe where it's life-threatening. You can't breathe, your throat feels like it's closing up. And at that time, you definitely need medical attention, or medication needs to be administered. Let's talk about that is why you would use it. Let's talk about when you would use an EpiPen. When you have these signs and symptoms of allergic reaction, those signs and symptoms could be anything from, like I said, from mild to severe. The mild symptoms, again, are your swelling of the eyes, your watery eyes, your sneezing, your runny nose, you have hives or rashes on your body or on your arm, you're vomiting, you might even have stomach pain. Those mild symptoms, you may just need to take an antihistamine, some type of Benadryl, some Zyrtec, Claritin, very mild. But when you have a severe reaction, severe meaning anaphylaxis, meaning life-threatening symptoms, and those symptoms are: you have hives all over your body, you're wheezing, you're coughing, you're short of breath, you have tightness in your throat, your tongue, your lips begin to swell, your heart is beating fast, hard, your blood pressure begins to drop. Some pass out, some experience cramping, nausea, vomiting, and even diarrhea. And at that time, you will administer the EpiPen. This is an EpiPen. And the substance in the EpiPen is called epinephrine. And in epinephrine, today we also call it adrenaline. And you know what adrenaline is? It's that hormone that's in your body. When you're working out, you're pumped, you're moving, your heart is racing, everything is excited, you get nervous, such. That is epinephrine. And basically the epinephrine works by stimulating your heart, increasing your blood pressure. It relaxes the smooth muscles in your lungs, and that's what's constricting your breathing. So it relaxes the muscle to allow air to flow through your lungs. It also reduces the swelling and the hives or the rashes that you may experience when you're having an allergic reaction. This is your EpiPen. When you're not having an allergic reaction, you want to definitely check it out. Make sure that the expiration date is still valid. Make sure that the chemical in here, you see this little window, make sure that it's clear. It's not cloudy. If it's cloudy, it's no good. You then discard it, throw it in the trash, go to the pharmacy, get a new one. And definitely check the expiration date. So when you're having a allergic reaction, an anaphylactic reaction, you definitely flip open the cap, remove it from the canister. The easiest way to remember how to hold the EpiPen is blue to the sky, orange to the thigh. Simple, easy saying to remember. Blue to the sky, which is blue pointing up, orange to the thigh, meaning orange pointing down. So after you remove the EpiPen, I'm going to get the trainer because this is a live EpiPen. I don't want to give myself some epinephrine. You might see me pass out. So on the EpiPen, blue to the sky, orange to the thigh, what you want to do is, I'm going to have to stand up. What you want to do is you want to hold the EpiPen firmly in your hand. Grasp it. Then you pull the blue cap up, just straight up to the top. Then you turn to the side. You want to administer the EpiPen on your thigh. You don't want to do it on the top of your thigh. You don't want to do it on the side of your thigh. If you can get it right in the middle of your side and top, that is perfect. So basically, your leg would be down, but for demonstration purposes, I'm going to have my leg up so that you can see. You take it and you swing firmly. Inside this orange part, there is a needle. So it will go through your clothes, it will go through jeans, it will go through your thickest corduroys, even if you have those. It is meant to do that. So you take it and you swing firmly, hold it firmly, and you swing firmly till you hear it click. Let me see if I can show you how it clicks. Heard the click. After the click, you want to wait 10 seconds. Count to 10. Have someone count to 10. Fine. After the 10 seconds, you remove the injector. The needle then goes back inside the orange cylinder. Take it, and you take your hand and you massage the injection site for 10 seconds, excuse me. If by any chance, before 911 comes to get you, because at the time of the injection, you definitely want to call 911 because you have about 20 minutes to get to the emergency room, to get EMS to you, because there are additional medications that need to be given. In the meantime, you can give yourself some type of antihistamine, the Benadryls, the Claritin, the Zyrtex in the meantime. After about 15 minutes, if you have not gotten to the emergency room or EMT has not found you yet, but you feel another anaphylactic reaction coming on, like you feel your chest is about to close up again, definitely take another EpiPen. Not the same one, because these come in pairs. In your box, there's 2 of them. You take the second EpiPen, do the same thing, remove the top, take it, but you administer it in the opposite leg. Same space, same on the side of your thigh, same way. 10 seconds in with the needle, take it off, massage for 10 seconds, and get to the emergency room ASAP. It's very rare that a third anaphylactic reaction occurs. Definitely get to the emergency room. Because this is a medication in the EpiPen, there are some side effects. And again, it's adrenaline. So you're going to feel the same type of side effects as your heart rate. You're going to have an increased heart rate. Your heart may be pounding. You might be sweat. You might have nausea. You might have vomiting. You might even have difficulty breathing. You may be pale, dizzy, weak, headache. You might be nervous. You might be shaking. You're trembling. And you might experience some anxiety. So, in my conclusion, I hope today that you've learned something about the EpiPen, the ingredient in the EpiPen, how to use the EpiPen, what's an allergy, what are some of the things that people are allergic to. Because you never know, the knowledge that you gain today may save your life or someone else's life. Thank you for taking the time to listen to me and for me to demonstrate how to use an EpiPen. Thank you.